Hello, everybody, and welcome to Medicare School Daily Live. I'm your host, Erica Smiley. I'm here with Mr. Marvin Music today, and this is brought to you by MedicareSchool.com. So a lot of you may be familiar with us, maybe you're even clients of ours, but at Medicare School, we focus on helping people with enrollment, assistance, and Medicare education. So we're actually the largest, number one educator on YouTube when it comes to Medicare, and we help thousands of people every month who call in, and we talk with them and really educate them on all their choices in Medicare and help them make the best decisions. So really, we're excited to be here today. We're going to be taking live calls, but we're going to start with a brief teaching. Marvin's going to share a little bit and talk to us today about, I think, the biggest myth. Correct? Yes. The biggest myth that we have at age 65. But first, I do want to let everybody know before Marvin starts teaching, if you want to call into the show, we're here to take any questions you may have in general on Medicare. If you have any questions specific to you, in your case, we would love to help you. So you can give us a call. The number is 833-824-2004. And you can see it right there on the screen. So call in and we're going to address your questions. But let's hear from Marvin a little bit.
All right, very good. Also, if you have any questions about Social Security, we know that subject pretty well also. So we are excited to hear from you here in a minute. Let's talk about the largest myth that exists in Medicare. There are probably several, but the largest one would be that people are told that they must begin Medicare at 65. And let me say that again, some believe that you have to start Medicare at 65, and that is not so. Now, I want to clarify, there are some of you who should start Medicare at 65, and if you don't, you've made a mistake, but not everyone has to. And so let's talk about those who must start Medicare at 65. That would be, first of all, anyone who's no longer working or their spouse is no longer working, meaning you do not have an employer-provided plan available at 65. You should start Medicare at 65, and if you don't, you made a mistake. Anyone that's covered by COBRA insurance should start Medicare at 65. Anyone that's on TRICARE insurance, meaning military, retired military, again, starting at 65. Anyone that's working for a small employer, and there's a lot of confusion around this area here, but a small employer is defined by Medicare as 19 employees or fewer on the payroll. Has nothing to do with how many are on the plan, but on the payroll. So that's full-time, part-time, doesn't matter. 19 or fewer on the payroll, you have to start Medicare at 65. Now, I want to clarify those three, the last ones I mentioned, which were on COBRA, on TRICARE, small employer. And the reason for that is because what happens, those insurance providers, those insurance companies, TRICARE, small employer, and COBRA, what happens at 65 is they move to this second payer position. You have to put Medicare in the first payer position because those insurance providers are no longer responsible to pay first. And so if you do not enroll in a Medicare and you're on one of those three types of coverage, then you become the first payer. So Medicare must move in the first payer position, and if not, you're going to. So we see people make that mistake all the time, and it's really unfortunate. And then the last group of people that must go on Medicare at 65 would be those that are on an individual plan, could be a family plan, but individual that is turning 65, and they're covered by one of the Affordable Care Act plans, often called the Healthcare Exchange. Those plans that we secure through the federal marketplace. Those plans, what happens is if you keep them at 65 and beyond, you will lose all incentives. There will be no subsidies whatsoever, no premium tax credits, no reduced cost sharing, no premium reductions at all. You will pay full price. So you are not going to stay on an ACA plan once you turn 65. And some people say, hey, it's cheaper for me to stay on ACA. Well, it may be, but it won't be once you turn 65 because, again, the incentives are going to go away. So quick review. Who has to go on Medicare at 65? Anyone who is not working or spouse no longer working, on COBRA or on TRICARE, small employer plans, and ACA plans. You must go on Medicare at 65, which means there's one group that does not have to go on Medicare, and that's anyone who is still working or your spouse is, and you're going to plan to continue working, meaning that employer-provided plan is available. You like the plan, the price is good, the coverage is good, the network is good. You do not have to do anything at all with Medicare. You don't have to do A, and you don't have to do B. Now, a myth that's kind of a sub-point of this one is some people are told, okay, you don't have to take Medicare B, but you must take Medicare A at 65, and if you don't, you'll be penalized. And that is not true. You will not receive a penalty on Medicare A as long as Medicare A is zero premium to you, which is 99% of all people. And the reason we get zero premium Part A is because we pay into the Medicare tax system as we're working, FICA taxes, self-employment taxes. And as long as we have accumulated what we call 40 quarters, which is 4 quarters per year, so that's 10 years worth of work paid into that system, then we will get premium-free Part A for the rest of our life. So there's no penalty at all. And so as long as A is free for you and they'll be penalized, whether you start at 65 or you start at 85, doesn't matter, there'll be no penalty. The only people that are penalized on Part A are those that have to buy it. And there are some that have to pay a premium for A because they don't have 40 quarters, they can't get it from a spouse or an ex-spouse, so they buy it. If they don't start at 65 or when they retire, then they could be penalized. But again, that's only 1% of the population. All right, and so in regards to Medicare A, I want you to know that the reason this matters is because some of you could still be working, or spouses, and you all are contributing to a health savings account, HSAs. And so what happens if you did enroll into Medicare A only, and you're the worker and you're covered by a group plan and you have A only, then you can no longer put new money into your HSA. The HSA money you have is yours, but you can no longer put in contributions. So what I would do if I'm still going to work, I would continue to contribute to my HSA. Do not enroll into Medicare A. You don't have to worry about being penalized, and I would continue to build up the HSA. It's money goes in pre-tax, it grows tax deferred, and if you use it on qualified medical expenses, you never pay taxes on that. It's kind of like a healthcare IRA. So we love those. Now listen, if you are turning 65 and you're going to keep working, or your spouse is, and you don't have an HSA, then I would encourage you, do take A only. Don't take it because you're worried about being penalized. We know that's not true, but it is good to take it. And Medicare A, when you're covered by a large employer, will be the second payer, and they may pay something if you went to the hospital. So that's why I would enroll in that. And so again, the big myth, not everyone has to, the big myth is people think they have to start at 65, and you don't. Some do, but many do not. And so I want to clarify one more thing that gets very confusing, especially for those people that are already on Social Security. If you're on Social Security, you're automatically enrolled into A and B. Medicare card shows up about 3 months prior to your birth month. So what happens is there's people that are enrolled in Medicare A and B, card shows up, but they still have a group plan option available. It could be their own, it could be their spouse's, but they're automatically enrolled in A and B. What I would do in that situation, if I have good group coverage, the price is very attractive, what I would do is I would disenroll from Part B. And the reason is because if it's a large group, B is going to cost you at least $202.90 a month. It's in the second payer position. So what I would do is I would disenroll from B. We do that with a Form 1763. You mail that to your local office or drop it off, and they'll drop off the B, and now you'll have A only, and you can pick up B at a later date. Again, that's for people that have a group plan of 20 or more. They're their spouses. You don't have to stay enrolled in Part B. My opinion, it's a huge waste of money. So don't do that. You can pick up B later whenever you or your spouse decides to retire. All right, so I know that's a mouthful, a lot of information there, but hopefully that was helpful, and Eric and I are ready to take your questions.
Yeah, good info, though, because I think more and more people are working past age 65, but they're afraid they're going to make a mistake, right? That's right. A lot of the main reasons we talk to people. They're worried about making a mistake and getting penalties, and nobody wants that. So, all right.
Yeah. And what's really interesting, Erica, is the misinformation that comes out of Social Security offices. I had a call this morning from a client, and I was setting up on his Medicare, and he was in his initial enrollment period, but we were waiting until the very last month to start his Medicare. And so I told him what to do. I said, take this 40B form down to the Social Security office and turn it in this month so he can start March 1. He's still in his IEP. Shows up at the Social Security office, waits an hour to get help, and then the person that helps him at the counter says, oh, you need an additional form, an L564, request of employment verification. He didn't need that form at all. Yeah. It's not necessary during an IEP, but even people at Social Security offices sometimes, because they're not trained well enough, will give out wrong information. And that's really what everyone has to be aware of today. There's a lot of misinformation surrounding Medicare. So you deal with someone that knows what they're talking about. We do, and there's others out there that know as well, but you want to be sure you're dealing with someone that really understands this business well. I say it this way. People can oftentimes put some of the Medicare pieces of the puzzle together, but they can't complete the puzzle. They can't, dot all the I's and cross all the T's. They don't understand Medicare well enough to do that. So there's a lot of people that are quite dangerous, frankly. And so this guy got bad information at a Social Security office.
He should have told him. Marvin said, I don't need that
exactly
form, right?
I sent him back, said, you don't need the form.
All right. Well, if you've got questions for Marvin, let's get some calls going here. So again, if you want to call in and have your questions answered live, the number is 833-824-2004. And really, we just want you to give your first name. We're not going to get any sensitive information here. This is live, but we can scrub out any birthdays, anything like that. We're not going to give your personal information out. We just want to answer any questions you have on Medicare and Social Security. So let's take our first caller here.
Okay.
Hello, and welcome to the Medicare School Daily Show. Who do we have on the line here?
Christy.
Christy, hi. Where are you calling us from today, Christy?
Washington, D.C.
Oh, nice.
Very good.
All right, great. So, you've got Marvin's ear here. What questions do you have for us today?
I just have a question about IRMA calculations. I know about the, if you're married, not married, and the caps and things. And I understand several times I've heard someone say that IRMA is based on your 1040 form, line 11, and something else, an adjustment. But I was wondering, but it says modified. So I'm wondering if the modified does include rental income, because that's passive income, especially for small landlords like myself, that just have like an English basement or we rent out a room, and it's just passive income. It's not a major business.
Yeah.
So does that come into calculations of the 109?
No, it's going to. No, your rental income is going to count against you. It'll be part of the IRMA formula. So modified is defined this way for Medicare purposes, because when you look at the taxes, there's different formulas for modified adjusted gross income, several of them actually. But for your purpose of IRMA, it is line 11 plus line 2A, and that's it. Line 11 is your adjusted gross income. Line 2A is tax-exempt interest. You didn't have to pay federal taxes on the municipal bonds, but you had to report that number, and that number goes into line 2A. So they add line 11, line 2A together, and that's the modified adjusted gross. So I'm sorry that you would like them to define it differently, but they're not going to. That really is the formula. Now the other thing that's important, Christy, is that remember they're going to look back at 2024. So if you're starting Medicare in 2026, they look back at 2024. Next year, they'll look at 25, and this year's income they're going to look at in 2028. So it's always 2 years back. Now, if someone has a life-changing event, they retire or semi-retire, or there's a death, divorce, or marriage, then they have the opportunity to be able to ask for a reconsideration of the IRMA. We call that appealing the IRMA. So if we have a qualifying life-changing event, we can say, stop looking back at 2 years. I just retired, or I just semi-retired, and we can give them new tax numbers. So if that happened this year, they're looking at 24, but I can ask them to look at 25 or tell them I want them to look at 26, and they will do so as long as that life-changing event has occurred in the last 2 years. All right, so that's modified adjusted gross, line 11 plus 2A.
All right, does that answer your
line
question?
11 doesn't. Go ahead, because line 11 does include line 7, which is capital gains and losses.
That's right. I see. All your income is going into the AGI. All of it is. You have a few deductions that will reduce that total income, but you're right. AGI is all income.
So that would include your rental income.
Yes, it does. Yes, that's what I'm saying. Yeah, it includes everything, for sure.
Okay.
Yeah, does that answer your question? I know, not the answer you wanted to hear, right? But those IRMAs like Marvin.
No, it's just a matter of, I think it's important because people are also downsizing. People would sit up there and sell their property, so they have a capital gains, and they may be exempt $250,000.
Right.
And I was just wondering how they go about, factoring all that in.
Sure. Well, unfortunately, it's all of our income. There's a few deductions prior to line 11, but all the income is going to count. But, Christy, hey, we appreciate the call.
All right,
Okay.
thanks, Christy. Yeah, and like Marvin
Thank
said,
you.
Yeah, and like Marvin said, if you have an IRMA 1 year, that doesn't mean you're going to have it forever, right? They're going to reassess, they're going to look back 2 years, and they're going to recalculate that IRMA each year. So, all right, good deal. Let's see if we have another caller on the line. All right, we've got our next caller. Welcome to Medicare School Daily Live. Who have we got on the line with us?
Jane.
Hi, Jane. How are you doing today?
Fine.
And what state are you giving us a call from?
Virginia.
Oh, nice. All right. And well, you've got Marvin here. And what questions do you have for us today?
I turned 87 this month.
Happy birthday.
I have been with have had a supplemental policy. I would say since I qualified for Medicare. It's presently with Aetna. Of course, the premium keeps going up every year. I have thought about checking to see if I could get a policy with less premium, but just never followed through. But I got a letter from notifying me that Medicare supplement policies with in Virginia, Virginia insurance code permits an annual open enrollment period that starts on my birthday, which is this month. So I thought, and then your feed came up on my phone today, and I thought, well, I think I'll check to see if there is a possibility I might be able to get my premium cheaper.
Yeah, good timing on that.
Yes, yeah. Virginia just recently became a state that allows a birthday rule. And during that period of time, Jane, you're not going to have to go through underwriting, which is really attractive. So what I'd ask you to do, you can see on the screen, hopefully you can, there's a number you can call, 833, not to be on the show. What's that number?
Yeah, it's 833-3661. And Jane, we can also text you after this call too, so you have the number.
Yeah, Jane. So we'll send you a text, and you can call that number, and then the agents can tell you exactly what to do, what the premiums will be, and sometimes your rate is, you may find it still competitive, but if you've been with them that many years, that's 22 years on that plan, so there may be something that would be more attractive. And so one of our agents would be happy to give you those premiums, then give you some direction as to what you can do to improve your position. Okay? So
okay.
Anything else, Jane?
No, that's it.
All right, sounds good. So yeah, we'll send you the text, reach out to us, and we'll help you.
That'd be a good birthday present,
Okay,
huh, Jane? If you can save money on that supplemental plan, that'd be a good birthday gift, huh?
Exactly.
All right. Well, thanks for
Thank
calling.
you.
Take care. All right. Hello, and welcome to Medicare School Daily Live. Who have we got on the line with us?
Hi, this is Terry.
Hey, Terry. How are you doing today?
I'm doing okay.
Great. And where are you calling from?
Calling from Oregon.
Okay.
Oregon. Okay. Perfect. So what can we help you with today? Do you have Medicare and Social Security questions for us?
Yeah, basically, I applied for Medicare Part A year and a half ago when I turned 65, as I was told I needed to. Just got laid off last week, and not sure what the next steps are. So, just trying to read through all this stuff around the difference between original and the Advantage plan, and if I need to buy D or E or F or G, it just gets all kind of confusing.
Sure. Hey, Terry, let me ask you this. What you said your date? What's your date of birth?
I was told not to give that.
Okay, fine. Just give me the month. I'm good. I know you're born in 1960.
Okay. Yeah.
Okay, sounds good. And so, are you planning to find other work and try to get other insurance, or are you going to go ahead and retire?
Well, neither, actually. I don't think I'm going to be able to find a job in my field at my age, but I'm probably going to go into private practice. So I'll be starting my own business.
Okay. And the employer-provided plan that you have right now, is it good through the end of this month or the end of March? When will it terminate?
Yeah, probably the end of March, possibly April. So.
Okay, very good. Well, what I would do if I were in your position, not knowing for sure how the employer is going to classify your coverage, my concern that March 1 on, would that be considered a COBRA plan? If it is, then that's not good for you. So let's assume that it would be COBRA. So if I were in your position, I would want to start my Medicare March 1. You can do so. You get plenty of time to get all that set up. And so in order to do it effective March 1, you're going to go through what we call the SEP process, called Special Enrollment Period. And so it's real simple to do. There's 2 forms. And by the way, Terry, if you want to use our company, we'll do all this for you. I do it all the time. Be happy to do it. But a form that we're going to complete for you would be called an L564. And that form, we would initiate it, email it to you, then you would take it to your HR department or email it to your HR department, and they're going to verify that you have been working and have had insurance back to when you turned 65. And so it sounds like to me that was, you said your birthday is that right? Okay, very good. And so we just have to verify that you've had insurance back to 65. Have you changed employers since then, or has it just been one employer for several years?
No, just one employer for the last 7 years.
All right. So then that employer will verify the employment. They'll verify the insurance dates. And then with that form, then we're going to add to that form another one called a 40B. It's a very simple form. And that form is going to have your Medicare number on it and your name and Social Security number. And then in the comments section on that form, you would put, please begin my Medicare 3/1/2026. And so both of those forms then would be submitted to your local office. Is there a Social Security office fairly close to you?
No, we're pretty rural. I'll have to look around, see where that's at.
Okay, good. Well, here's why I ask. If you can't drop it off in an office, it's fine. But we always recommend faxing and then follow up with mail. I don't like just one enrollment. I'd rather do 2. We used to fax all the time, and half of them got lost, and you can't confirm them with Social Security office, and they'll never own a mistake, or rarely will they own a mistake. So you can fax it and then mail a hard copy in, and requesting a 3/1 start date. So that would take care of your Medicare A and B, and then from there you're going to have to decide how you want your Medicare to work. And there's really only 2 systems. You can go with A and B with the supplemental plan, or you can enroll in A and B and get an Advantage plan. And there are lots of differences between those 2 systems. You'll have to decide, what's best for you. The majority of people that go with the supplemental plan do so because they can afford them. Number one, there's always a premium to a supplemental plan. But when we pay a premium, what we're getting is an insurance plan that will have no networks, which is nice. You can go to any doctor that takes Medicare, and especially if you're in a rural area. There may be very few Advantage plans available anyways. So the original Medicare with a supplemental plan lets you go to any provider that takes Medicare. You will never have a pre-authorization imposed upon you by the insurance company, and you'll have a permanent lifetime plan. Pay the premium, it's yours forever. You move away from Oregon, wherever, you can take your supplemental plan with you. So that's one option. The other option is to do an Advantage plan. The Advantage plans are usually 0 premium. You probably don't have a lot of options where you are, but if you did have them, the issues with Advantage plans that I don't like would be always have networks, HMOs or PPO networks. So you're going to be definitely limited on providers. Number 2, you will encounter prior authorizations if you have any kind of an issue like a need for an MRI or a CAT scan, hospital stay, any kind of a surgery, in or outpatient. They're going to pre-authorize that. So now you have the insurance company that has the right to run interference. Why? Because they want to make a profit. And so pre-authorizations can be a nuisance. Now, they're not if you're perfectly healthy, but when people have problems, then they're going to see exactly how their insurance is going to work. And then thirdly, Advantage plans are only 1 year at a time. 2.5 million people lost their Advantage plan last year because the companies terminated those plans. And so I share all that with you because those two systems are available. They're different. Kind of the way I describe it, kind of silly, but I believe it's true. Toyota makes a Corolla, and Toyota also makes a Lexus. And those are both cars. They will get you from point A to point B, but I can assure you the ride is different. And so I look at the Advantage plan like the Corolla. I look at the supplemental plan like the Lexus. It's just a different quality of a ride. And so my view is this. When people cannot afford a supplemental plan, they should not try to get one. They should go ahead and take the Advantage plan, the very best one that can serve their needs. Sometimes people just are attracted to the premium on a plan. If that's all you care about, then go with an Advantage. But if you're looking for high quality insurance, something that's permanent and no hassles as far as pre-authorizations and unlimited providers, then I would go with the supplemental plan. That's what I did. I just turned 65 last month, and I have a supplemental plan. And between those two supplemental plans, you have two primary choices right now. About 60% of all people take G, and 40% of all people take N. I think they're both wonderful. You have all the benefits of a supplemental plan. The only difference is G is a little bit more comprehensive, cost about $50 more a month than the N plan would. And I could run a quick rate for you if you'd like me to. I'm happy to do that in your area. Would you like me to do that?
Sure.
Okay.
Yeah, Marvin can pull up some quotes here too. I was going to say, and we'll follow up with you after, because one thing we do, I know you asked about a drug plan as well, Terry, and that's the thing. If you go with the supplemental route, then you do need a separate Part D drug plan, and that's something we can help with. We ask your medications, what doses you're on, get all that information, and help match you up with the best drug plan as well. But Marvin can pull you up some rates here for the difference between the Plan G and the Plan N in your area.
Yeah. And one thing I was going to say about the drug plans, the nice thing about supplemental plans is you get to pick your plan. You explained that. I think that's very beneficial.
Yeah, so it's interesting. You know, the supplemental plans, there's a lot of different companies that offer supplemental plans. And so obviously we look at the best rate, right? We want to get you the best rate. But we also look at the best rate stability. A lot of people worry about customer service, right? They'll say, well, I've used company XYZ or company ABC. Which one's going to give me the best coverage? With these supplemental plans, the government regulates how they cover. So a G's a G's a G, an N's going to cover like an N no matter what company you go with. But what we do, we've just got years of experience in working with these companies. We can help you find a good rate, but also we'll help you find a company that's going to be rate stable. I don't know if you're listening, Terry, but we just talked to a lady before who's 87. She's been on the same supplemental plan for like 22 years, and the rates do go up with inflation, medical inflation, rates go up, but we'll help find you a company that's going to have smaller increases, hopefully, than larger increases as you move forward. So
two quick questions. You mentioned, I may be on COBRA for a couple months, but that technically doesn't count as insurance, so I should overlap during that time?
Well, what happens, it counts as insurance, but COBRA is only going to be in the second payer position. So if you don't enroll in a Medicare B, you already have A, but if you don't take B, anything on the B side, then you would be responsible for, because that COBRA policy only has to pay second, and that's all they will pay, by the way. Hey, Terry, what's your zip code, sir? Zip code?
It's
okay.
Yeah, well, Marvin pulls that up. A lot of people don't know that, right? They leave a job and they're offered COBRA, but yeah, when you're 65 years old, if you had a $100,000 medical bill, they're only going to pay in the second payer position. They'll pay $20,000, and if you don't have Medicare or something in that first payer position, you're going to be on the hook for that.
Yeah, you would regret that decision for sure. Quick question: Are you married or single?
married.
Okay, good.
And my wife is a year or two behind me. She doesn't turn 65 till next January. So that's my other question is, like, she would be picking her own plan, right? She wouldn't be part of my Medicare plan.
No,
is that correct?
No, yeah, definitely Medicare is all individual. But most married couples usually go with the same carrier. And when you go with the same carrier, what happens is they'll give you an additional discount. We call that a multi-policy discount. And Terry, I'm assuming you're non-tobacco. Would that be correct?
Correct.
Okay. Yeah. Anyway, so no, she picks out her own plan. She can do whatever. Sometimes we'll have a husband wants a Medicare Advantage and wife wants a supplemental plan. It's fine. You can do that. I was just saying if you both want subs, then if you go with the same carrier, then there can be some additional discount. So right now, it looks like like the lowest G plan in your market is right at $200 a month. It's actually $199.24. $199.24, and that'd be a G plan, which covers everything except your Medicare B deductible. So it's almost full coverage. It's actually the most comprehensive plan that you can get today. And there's other carriers, of course, that are going to be higher than that, but that was about the least expensive plan. And by the way, that company that I quoted you, I'm not going to tell you who it is. I can't do that on the air, but they're also a stable company. A very solid, stable company. And the in-plan looks like to me about the lowest right now is about $141 a month on the in-plan. So that's about about not quite $60 a month difference. So if you went with the in-plan, you're going to save about $700 a year. And the difference would be if you ever had an excess charge where a doctor adds 15% to the bill, then your in-plan will not pay that. G pays that. Excess charges are very, very rare. Less than 3% of the time would we even see it, but there is a small risk. I can't say no risk, but small risk on an excess charge. So in will not cover excess, G does, and then also the in plan, you would have a $20 copay anytime you would see a doctor or a specialist or PA, where G has no copays. But again, there's $60 a month difference there. So for some people, they like something a little bit more budget friendly that still gives them the options of, unlimited providers and no pre-authorizations, all that. So I think they're both good decisions. You just have to decide, really where your budget is and what you're most comfortable with. Okay. So that gives you an idea. Again, if you decide you don't want to pay a premium, then get an Advantage plan. I would just caution people, when you take an Advantage plan and you stay on an Advantage plan for longer than a year, now your situation could be even less, but let's say a year, and you want to get off of an Advantage and move back to the supplemental world, then in most states you have to medically qualify to make a move from Advantage to a sup. Which means we have to ask you 40 health questions, we have to check all your medications, and the insurance companies do not have to approve that policy. They have to now because you're starting Medicare B. They're required to take it regardless of pre-existing conditions. But after a year of being on a Advantage plan, they do not have to do that. So I'm just saying the timing and all this also really matters. If you're looking for high quality coverage, I would start your B31-2026 and take an Advantage plan. And then, of course, you work with us. We'll help you select the right drug plan as well.
Yeah. And like Marvin said, right now you can get one of those Plan Gs or Plan N with no medical questions asked. So it's guaranteed issue. You've got that Medigap OEP. You got that 6 months from when you start Part B where you can get that without underwriting. Yep. So does that answer all your questions, Terry?
I think so. I'll have to study up a little more on G and N and all that. It's all new to me. So
okay. And our guides, they can talk with you and really go through, kind of give you some visuals. I know we're just kind of talking here on the phone, but they can really walk you through like the main differences between a supplemental plan and an Advantage plan, help you decide which direction is going to be best for you. So yeah, we're going to follow up and shoot you a text message so you can talk one-on-one with a guide and obviously share some more information you can share with here on the phone. So
sure. Yeah, I want to add this as well. Terry, when you talk to most agents, they're definitely going to really press you to take an Advantage plan, and the reason for that is because we get twice the commission. Advantage plans are very, very profitable for insurance companies, are very profitable for agents. So we truly make twice the commission, but you don't have twice the insurance. The second thing we get lifetime residuals with Advantage plans. And insurance is always residual income, but supplemental plans only pay us 6 years. Advantage plan pays us for life. So my whole point is that agents are incentivized to push Advantage plans. But I think anyone's going to be honest with at least say, hey, you have both systems available, and they're going to work differently. There's ins and outs of both of them, and so I'm just saying to evaluate it. The agents typically are very motivated financially to make Advantage plans really appear like the next best thing to sliced bread, and they truly are not. I don't think they're bad insurance. I think when people get them, I think they'll be fine. But if you can afford the quality, we know at your age, you've been around long enough, you always get what you pay for, and that's true with insurance as well. All right, we appreciate your call, Terry.
All right, thanks, Terry. Take care. Yeah, I think
thank you.
Yeah. No problem. I think it is hard because I think people think right now when they go into the system, I'm healthy, I'm not on any medications, I never go to the doctor. I'm just going to grab this zero premium advantage plan. And it's hard to not think down the road. And unfortunately, my mom turned 86 years old yesterday. It's not if you're going to have chronic conditions or major health problems, it's just when. So definitely an important decision.
Yeah, it really is. Yeah, so we have to think long term, not just short term.
All right, so again, we're taking calls live. We're going to be doing this every Monday through Thursday. We'll be on at 10:30 Central Time, 10:30 to 11:30 Central Time. We'd love to answer your questions live and talk with you all, anything you have about Medicare, Social Security. And if you want to call in, the number is 1-833-824-2004. So that's the number to call in, and we'll talk with you here. You can talk with Marvin live. All right, next caller. Welcome to Medicare School Daily Live. Who have we got on the line with us?
David.
Hi, David. How you doing today?
I'm doing well.
Good. And where are you calling us from?
We're down here in San Antonio.
San Antonio. Is it warm there today?
It is. It is.
I've been in Indianapolis. We had 15 inches of snow, and it's been freezing. So I was hoping somebody with some warm weather would call in and talk with us today. So, all right, we've got Marvin here ready to take your questions. So what are you wanting to ask today?
Well, it's a couple of questions. I'm new to Medicare, and I was, of course, I'm getting all my information from Mr. Music and his wonderful company, so thank you for that. I would like to ask, I'm thinking about the Medigap policy and two questions in there, if I may. The first one would be, what is the difference, or what is better, issued age plan ends or attained age? That's one. And then two, if I'm in the hospital and I'm got, Part A, what about the different doctors that I will be seeing while I'm in the hospital? Will I be paying the co-insurance of up to $20 per doctor, or is that all covered under just Part A?
Okay. Yeah, in the hospital, the Part A is going to cover all the physicians, really everything that happens in the hospital. So your co-pays would not come into play only on outpatient type of doctor visits to a primary care doctor or a specialist. So that's when you'd have your up to a $20 copay. Never in the hospital, because your supplemental plan, whether it's a G plan or an N plan, either one of them will cover everything in the hospital. Really won't cost you anything other than if you have not yet met your deductible. You would have to meet that. So the doctors are all, of course, covered by B. So if it was your first claim of the year, you would have $283 worth of doctor bills that you'd pay, and then you'd be done for the whole year, with your deductible, because it's just an annual amount. And then after that, if you had an outpatient doc visit, then you'd pay your $20. Does that answer that question?
Yes.
Okay, very good. Now let's talk about issue age versus attained age. And first, let me just say that for those that are watching may not understand what he's talking about. Whenever an insurance company does business, there are actually three different ways that policies can be written. And these have to do with the pricing model as well as how increases can occur. And so there's three options, and it doesn't mean that every state has all three options. Sometimes a state insurance commissioner will dictate exactly which model must be used. And so those models are called issue age, attained age, and community rated. So issue age, community rated, and attained age. And so the difference is this. When someone has an attained age policy, which, by the way, you all, is the most common. This is throughout the country. Most states and most insurance companies and policies will be attained age. And what that means is that your policy initial premium is based upon your age. So if I come in at 65 and get a policy, that's going to be a lower premium than if I came in at age 70. So my initial premium is based upon my age, probably the gender, the zip code where you live, and that's what determines my price. And if I have an attained age policy, then what will happen 1 year later on the anniversary of my policy, then my premium is going to increase slightly. Usually it's a small increase, could be $4 or $5 a month, something like that, but it's very small. And so each year I can expect on an attained age policy for that to go up a little bit. Now, another way that attained age policies will go up and can go up, they also can take a group increase. A group increase means that the company that wrote the policy, they're paying more out in premium. They're paying more out in claims than they're receiving in premium. So once claims exceed premium, that means that group is losing money. And the insurance company has the right to ask for a rate increase to get back to where they started. So let's say they're losing 6%. Then they will do a group increase of 6% for everybody that is within that group. So that's the way attained age works. We expect an annual increase, it's very slight, and then a group increase occasionally. And the whole concept is by allowing an insurance company to raise rates annually at the anniversary of the policy, those extra funds offset potential group increases in the future. So we should have less group increases and less drastic increases. So that's attained age. Issue age is different in that my rate is based upon how old I am when I initially get the policy. So again, if I'm 65, my rate's lower than at 70. But in an issue age state, what happens is the only way rates can increase is if there is a group increase. They won't go up on an annual basis. And with issue age, because the insurance company cannot raise them up annually because of age, then they start higher. So you'll always pay more on an issue age policy. Now here's the problem. A lot of companies, a lot of agents give people the impression that because the rate will not increase because of age, that it will never go up. And that's not true. It absolutely is going to go up. Whether you have an issue age or an attained age, those prices are going to go up because both of them will have group increases. And so I don't buy into the narrative that issue age is necessarily better. It may be, but it's not necessarily better. It really is not. Now, another item would be there are some states that have to be issue age. Right now, I think there's 4 states in the country. I know Missouri's one, Georgia's one, Florida's one. I'm forgetting the other one. But the point is there's some state insurance commissioners that say the insurance companies must write an issue age policy. And then we also have community rated. And this is the highest premium. And the reason for that is because now age is never a factor. Gender is not a factor. Everybody that lives in that community. It could be a county. It could be a whole state. But everyone gets the same rate, which means what? It means that the person who's 85 is getting a bargain because the person who's 65 is the rates are averaged. And so people that are younger pay much more than those that have to if they had an issue age or an attained age policy. So I'm not a fan of community rated, but sometimes we have no choice. I think there's 8 states right now where the insurance commissioners say everyone gets the same rate. That's community rated. And again, those are much higher, but also they can go up. How do they go up? Again, when claims exceed premiums, the company's going to take a group increase. All right? And so you're asking me which is better. Number one, I think in Texas, I did not even realize, I think as an attained age state, as a general rule, there probably are a couple companies that will offer issue age. And I would just say to you, make sure you know those rates can still go up. So if it were me and there's going to be a $30 or $40 a month difference between issue age and attained age, I would take the attained age policy. I would take the lower premium because I know the issue age is going to go up anyways. And with that kind of a rate difference, there's not as many people that are going to go in that group. So I think you could get some sizable and drastic group increases with the issue age policy. Okay? Again, if you decide like, hey, I'm on an issue age policy because I have to be. I live in Missouri, and that's all they write. There are no attained age. There's no community in the state of Missouri, just issue age. But my rate, if I live in Missouri right now. I'm speaking to you from Kansas, and so right now, if I were to take a policy at 65 in Kansas, that rate would be about $140 a month for a G plan. In Missouri, that same G plan costs me about $215 more. So I'm paying what, $75 more a month just because it is an issue age policy. Missouri makes it that way. I'd much rather have the lower rate. So I'm paying $75 extra a month because of that law in Missouri that says it must be an issue age policy. All right, so I rambled on a lot about that, but I hope that helps you. None of us know what the future holds, David, as far as rate increases occur. But I promise you they all are going to go up. So what I care about is market share. how much of a market does that company have? Because the larger market share they have, the more people in the group, and that's really what is going to give you the greatest stability because the risk is spread out to more policyholders.
Well, can I do a follow-up on this?
You sure can, sir. Go right ahead.
Well, thank you. So let's say you do go with the Medigap insurance plan in, and you're going along, and about 10 years later, let's just say that insurance company goes out of business, and alerts us that we're on with them. Can we get another Medigap without having to do medically underwriting?
Yes, sir, you can. And by the way, I've been in this business not quite 20 years, close, and it's never happened, at all.
Okay.
So, and I'm not saying it couldn't happen, but if it did happen, what will happen? Here's the way the Medicare will handle that. They will give you a window of time, I would suspect somewhere between about 60 to 90 days, where you would be in a guaranteed issue right in Texas, where you could pick another insurance company's plan in without any underwriting, and that company would have to approve you. And issue that policy for sure. Okay, so you wouldn't be left in the dry. So if a company does go out, again, I don't think that would happen. All the MedSup companies are backed by actually life insurance companies, and they're guaranteed renewable for life, which means there is reserve actually set aside by insurance companies to make sure they can pay those claims for life. And they pay into an insurance pool for that kind of coverage. But if a company did go bankrupt, then more than likely another company would come in and buy them and make those policies whole anyways. But if they didn't, then you would have this guaranteed issue right. So you'd never be left out in the dry trying to figure out what you're going to do. There will always be a place for you to go.
Well, I appreciate all your help, and thank you for doing all your homework for us out here. Yeah. And looking forward to doing business with you.
All right, that sounds good, David. We appreciate your call and the opportunity to be able to serve as your broker, too. Thanks.
Yeah, great questions. Yes, and we'll follow up with you so you have the number to call in and get some help. Schedule an appointment one-on-one with the guides. They can look at those plans in Texas for you and really help you with the best plan.
Yeah, I want to just make a quick comment about David. David will get to use the services of our company, and there's no cost. And I think that's important for everyone to realize. When you use a broker or whoever you use, you never pay us. We've never sent a bill to anyone because the way insurance works, whether that's home and auto, whether that's life insurance, whatever, any kind of insurance, the agent's always paid by the insurance company. It is their cost of doing business. And so I encourage people, reach out to someone that knows what they're doing, whether that's us or someone else, because there's no cost at all to use the services to make sure that you're doing things correctly. Okay, so the insurance is designed to pay the agent. You do not have to do that. So.
Yeah, and I think it's good for people to know as well that we're a broker that works with all the major companies, lots of different companies. So, if you're shopping for car insurance, right, and you call State Farm, they're only going to give you State Farm rates and State Farm policies. They're not going to tell you Geico and all the other competitors, right? So that's the thing. We're not really tied to one insurance company. We can kind of give you all the options and all the different rates and what's going to be best for you.
That's right.
So, all right. Thanks so much.
Yeah,
that was a great call. Do we have another caller on the line? All right. Welcome to the Medicare School Daily live show. Who do we have on the line with us?
Hi, this is Bernie.
Bernie?
Yes.
Hi, Bernie. How you doing today?
Good. How about yourself?
Good. We're great. We're great. Thanks for asking. And what state are you calling us from?
Illinois.
Okay. Illinois. All right. Well, we've got Marvin here. What questions do you have for us?
So I currently applied and I'm on Medicare A and B and the D, and I have also my supplemental insurance. However, my concern is changing insurance going forward. I have one of the diseases that's listed in the 10 top where Medicare or the insurance companies could reject you for. So I'm wondering if I picked the right one that I could have for the rest of my life, or should I be looking at a different policy?
Mm-hmm. Okay, so clarify for me, you're saying you have a disease and you've read something where they could possibly not cover that healthcare needs for that disease?
Correct.
Okay.
Yes.
Do you mind?
The list.
Yeah,
they gave me a list of the 10, like heart and MS and so forth, and it said that it could be a challenge to change insurance companies if you have one of those health issues.
Okay. Yes. Meaning you would not be able to go through underwriting.
Correct.
Yeah, okay, I understand. Okay, very good. Well, a couple things about that. So you've already selected a G plan. Who's the carrier you have right now, the company?
Cigna.
Okay, very good. All right, so, and by the way, Cigna's who I have also. That's who I went with. And there's a lot of good companies out there. Cigna would be one of them. I think United Healthcare is wonderful. Aetna's wonderful, so there's a lot of good ones. So the way it works in the state of Illinois is you do have the right from the age of 65 to 75 to actually change companies if your company were to take a large price increase. Now, when you change those policies, you do have to stay with the same carrier. So if they're offering a better rate at your age with a different block of business, you have the right to be able to make that switch without underwriting. But then after 75, then the plan that you have would be yours, for the rest of your life. So you do have, somewhat of an exit strategy. It's not quite as liberal as it is in some states, but the state of Illinois does have the birthday rule, and it's 65 to 75, staying with the same carrier. So just know you do have an option. And so I think Cigna is a good company. I would not be at all concerned about them denying something. As long as Medicare is going to cover something, then Cigna will follow, and any insurance company will. So I just wouldn't be overly concerned about that. And if it's a real serious issue, then you'll be thrilled that you have a supplemental plan. Most people that have serious health problems and they're stuck on an Advantage plan are usually really disappointed in what their health care is going to look like, primarily because they can't go to any doctor they want to go to. So if I were you, I would feel rest assured you have a good carrier. You still have a place to go for the next 10 years. I don't know how long you've been on your plan, but it sounds like fairly new. And so if your rate were to increase, then you can always call Cigna back and ask them if there is a new block at a better rate, and they would have to offer that to you.
Okay.
Okay.
Does that answer?
All right. Well, thank you. That's good news.
Well,
yeah.
You're very welcome. You're welcome. I also think you're in good hands. And also, let me just note this. A lot of people have Cigna. Last year, a group called Healthcare Services Corporation bought Cigna, and they've made the decision to rebrand their entire book of business, and it's going to be called Health Spring. And so I would not be alarmed by that at all. They paid over $3 billion for Cigna, so they're not going to go in there and do a huge disruption. That's the last thing they want to do. So they just simply are rebranding. So what was Cigna is now called Health Spring. No problem whatsoever. If I would have struggled with that, I wouldn't have gone with them, and I did. I started my plan in January. So I know that I'll get Health Spring cards here in maybe the next 6 months or something, but everything else is really operating the same way. So I think you're in great hands.
All right.
Well, that's great news. And
yeah, and I think it's normal, Bernie, like any of the supplemental plans, you're going to see rates increase, over the years. It just kind of is how it is, But like Marvin says, you have very comprehensive coverage, great coverage, especially with you having medical issues and having to go to doctors often.
Yeah.
So
yeah. Plus, I will tell you this: Illinois is a really huge supplemental state. Lots of people in Illinois have supplemental plans, which, in my opinion, is wonderful. Which just simply means the group that you're in, Bernie, is probably quite large. And the larger the group, of course, the more stable the rates will be. So I do think you're fine.
Okay.
Yeah.
All right. Thanks for calling in, Bernie.
Thank you. Appreciate it. Have a good day.
Take care. You too. All right. We got our next caller on the line here. Welcome to Medicare School Daily Live. Who do we have calling in?
My name is Shailesh.
Shailesh?
Yes.
Hi. How are you doing today?
Fine. How are you?
Great. And what state are you calling us from?
New Jersey.
New Jersey. All right. Well, welcome. We're happy to have you call today. And what questions do you have for Marvin?
I have a question for Mr. Marvin. I am a 68 years old active postal employee with FEHB plan, United Health, which I like it. So after retirement, within 1 or 2 years, I'm thinking to keep my FEHB with Part B So in future, I am thinking I should not get any kind of bill since I am Part B and FEHB United Health. And premium for FEHB plan, both of us, is $500 per month. So is it good plan? I mean, good option for me to keep $500 per month for two of us, FEHB plan?
Okay. Yes, I think that's a good option. It's not like a great bargain, but it's in the market, so I think you're fine. I like it also because your prescription drug plan is included in that $500. So I think that's favorable. Another reason I like it is because if you were to go into a different type of plan, let's say if you were to take just a normal market G plan or N plan, a supplemental plan, you'd actually have to terminate your FEHB, and when you terminate it, that's permanent. And so to me, that's a little scary. And so I think now, do you have GEHA or do you have Blue Cross? Who do you have on FEHB?
I have FEHB with United Health Insurance.
Oh, you said that. You said that. I'm sorry. I'm so accustomed to people being on GEHA or Blue Cross.
Sorry.
That's good.
No, United.
Okay,
United
so
Health.
now my question is, I know that with GEHA and Blue Cross, they will give you an $800 a year credit if you will enroll in both A and B, which puts them in the second payer position, which is in their best interest. But I was just curious if United Healthcare does that also.
Yes, my United Health also offering $100 per month this year.
Very good.
But after 1 or 2 years, I'm planning to retire, and I'm going to continue my United Healthcare as well as Part B, and also United Healthcare same time offering Advantage United Healthcare too, which is without any cost.
Yeah.
So in short, after retirement, I have all three plans. Medicare Advantage, United Healthcare, regular United Healthcare, and Part B. So in future, I don't have to worry about any co-payment, co-insurance, or premium, or any deduction or anything. Only just pay the premium. I should cover 100% for any kind of procedure or surgery.
Okay, and that's fine. But I would encourage you. I would not take their Medicare Advantage plan if I were you. I would not do that. I would just have your A and B and have your United Healthcare as secondary to Medicare if they'll give you that option. And because with their Medicare Advantage plan, you're going to have some issues that could occur. But if you just have A and B and UHC in the second payer position, that to me is your best option if you had that available.
But what United Healthcare is saying, this is free of charge. You don't pay any extra, which is included United Healthcare plus Advantage also. It means they're talking about I have 3 insurance.
Okay, let me ask you this then. So are you saying to me that if you take their Advantage, then they're going to drop the $500 a month premium off?
No, it's the same premium, $500 for United Health, which is regular. But they also included the Advantage also.
Yeah, but you can't be in both systems. So what that means is that your Advantage plan is going to be the primary payer and the one making all the decisions instead of Medicare making the decisions. So you're paying $500 a month for that Medicare Advantage plan. So not only are they getting about $1,200 to $1,500 a month from Medicare because you enrolled in Advantage, you're also giving them $500. That's a bargain for them. I'm saying if it were me, if you're going to have to continue on with the $500 a month premium, do not enroll into the Advantage plan. Just keep your A and B as first payer, and United Healthcare will be the second payer, and you should not have to be out of pocket anything. That's what I would do. Because you can't have all three. It doesn't work that way. Because here's why. When you go to the doctor, and if you're on Advantage plan, you're not going to give them your A and B Medicare cards. You're going to give them your United Healthcare Advantage card, and that's who's going to be paying. If you don't have an Advantage plan, you do give them your A and B card, and then you would give them some sort of a secondary card that we would call that a supplemental plan. I don't know. I don't think that's what United Healthcare is going to call it. They're going to call it secondary to Medicare. They may call it an indemnity plan. But that to me is the best option because then you don't have to worry about any kind of a network at all. But my gut feeling is, sir, that you are not going to have that option. I think they're going to make you go on an Advantage plan. Okay? That's what I think is going to happen.
But if is there any email address or something I can send you the booklet of 2 or 3 pages what they're saying?
Sure.
So it's a little confusing. I understand what you're saying, but this little confusing. It says Advantage is included free of charge with the United Health. So that's where I am also clear. Once you read it, once you look at that paper, can I send it to you?
Yes, sir. I'd be happy to do that. Yeah, but all I'm saying, if free of charge, if it's free of charge, then they would not be making you continue on with your FEHB premium. That's what I'm saying. So, well, let's find out. I'll read it. I'm happy to do so. So, we'll have someone.
We can follow up with a text message to you, so we can get together and connect. But I think the best way I explain it is. Those Advantage plans, even though it's $0 monthly premium, they're saying you don't have to pay anything extra for it. What Marvin's kind of saying is Medicare Advantage plans are called Part C because they actually replace A and B. So that's the thing where you get into the whole Advantage system and networks and some different things. So yeah, we'll follow up with you. Let's talk one-on-one with you so we can really kind of take a look at what that is and help you evaluate. Does that sound good?
Sure.
All right.
Sure. Is there any email address or phone number I can send you those three pieces of paper?
We'll have our producer. He says yes.
He's going to send you a text message. Yeah, they're going to shoot you a text message and get you information where you can get in direct contact with us. Sound good?
Sure.
And we'll read that through.
Thank you.
Yeah. Hey, thanks for the call.
Yeah, and congrats on your future retirement. So, all right, everybody. Yeah, thank you. Great calls today that we had. We're excited to be here. We're going to be here again tomorrow. So if you did not get to call in today or we didn't get to your call, we'll be back again tomorrow, 10:30 Central Time to 11:30 Central Time. But if you need assistance right now, today, we have guides here ready to help. So expert guides, licensed in all 50 states. Our number, if you need help today, is 833-833 3661. Did you see me squint? I had to squint to read that. But 833-833-3661. It's up on the screen there. So if you need help and want to talk to somebody today, we have agents here till 7 p.m. Central Time this evening. You can give us a call. But we appreciate you guys calling in. It's been fun to talk to you, and we'll see you again tomorrow.
Thank you very much.
Thanks.
See ya.